Let's bring in Brittany Kmush. She's a professor of public health at Syracuse University, specializing in infectious diseases and vaccines. She joins us now from Syracuse, New York. Professor, let's begin with this week's confusion with the World Health Organization dealing with the asymptomatic spread of coronavirus. They have since clarified their remarks, but there's still a lot of unknown with COVID-19. As a reminder for us all, what is known?
Right. So thank you for having me. So unfortunately, there is still so much unknown about this virus. But what we do know is that the virus can be transmitted asymptomatically and pre-symptomatically. So asymptomatic people are people who get infected but never show symptoms. And then pre-symptomatic people are people who are infected and they just have not yet started to show symptoms. So we do know that that transmission does happen. What we don't know is the extent of that transmission and how common it is for the transmission to occur through those types of people.
Do you think the WHO just misspoke, or was this a serious error on their part?
I can't really comment as to exactly what they were thinking, but based on their clarifications, I think it was just a misspeaking in the moment.
A report this week claims the lockdowns that we've seen around the world for months saved millions of lives and prevented more infections across Europe and around the world. The EU is opening to cross-border travel very soon. What trends will you look for and watch for in the coming weeks?
So as people and places start to reopen, we will want to keep a close eye on the number of cases, new cases, especially in hospitals or attending clinics. As well as the number of tests available. And so we want to make sure that as places start to reopen, that we're able to test everyone who thinks they have symptoms so that we can closely monitor if there are new cases.
And I want to ask you about the U.S. specifically now. Cases here rising with over 2 million, especially in close to 24 states that have already eased restrictions. We saw protests across the country over the last 2 weeks. Could we see the beginning of a second wave here?
Yes, I mean, it's a little too soon to know for sure. However, based on how the virus is transmitted and that we are still seeing cases, the protests from a purely pandemic standpoint do increase the risk of us seeing new cases and a new spike in cases.
And we're seeing Johnson & Johnson, as it announced it could begin human clinical trials for a vaccine very soon. And it seems there's been a lot of other progress around the world. Are you optimistic about a potential vaccine soon?
I am optimistic. I don't know the exact details of all the trials and where they're at. But moving into humans is a great start. So that they're starting to test the vaccines in humans is very helpful and hopeful. And I am optimistic that we could potentially see a vaccine available early next year, early 2021.
All right, Professor Brittany Kmush, thank you so much for joining us from Syracuse.